Hello, welcome to Surgical Assessment Unit, Ward D6. My name is Bindhu Philip. I'm one of the clinical nurse specialists working in Surgical Assessment Unit. So my post actually is like a hybrid post. I work with the medical team as well as with the nursing team. Here in Surgical Assessment Unit, we cater patients from general surgery mainly. They are colorectal, upper GI, and also hepatobiliary. But these patients come from general practice or emergency department. They don't have to be pre-booked. They will be walking in the same day referral. But also we get other specialties of patients from urology, plastics, ENT, ophthalmology, and vascular. SAU has 15 outpatient chairs, which we get the patients from GPs and EDs. They will wait for the consultant or the registrar or the medical team to be reviewed and make the plan. And we have 21 inpatient beds. For some of them will be going for surgery, or some of them will be having the treatment and will be discharged. This is a 48-hour stay. We also get patients from emergency department from other specialties like orthopedics too, which means the nurses get not just the patients who's looked after as an assessment unit, they also get the experience of looking after patients who is on an inpatient area on a longer stay, looking after their skin, their mobility, and their discharge planning. Everyone knows the current pressure for NHS is there's no bed capacity. So what we do as a surgical assessment unit, we also help to decongest the pressure of the ED, taking surgical patients who are appropriate for the unit. Cambridge University Hospital is a teaching hospital, as everyone knows. I came over to UK since 2008. I've been working as a band 5 and progressing to 6 and a 7, but I'm a clinical nurse specialist. I did my part-time university course with the support of Cambridge University Hospital. So there's lots of opportunity to study. We have band 5 nurses, band 6 nurses, band 2s and band 3s, and also there are nurses, there are people who have no experience from outside. If they wanted to come here and train to become a nurse, there are opportunities for trainee nursing associates and apprenticeship pathway to become a nurse. So there's lots of opportunities, don't miss it.
Good day, my name is Jess. I'm the ward manager of Surgical Assessment Unit. A normal day on the Surgical Assessment Unit depends on whether you're going to be working. The inpatient part of the SAU starts on the daily medication rounds of nurses. It will be followed by the assisting of patients with their morning personal care, dressing, and mobility practices, because we have 8 specialties in SAU. Healthcare assistants take usually their observations, vital signs, perform point-of-care checks, and general care of patients. They work hand in hand with the nurses. Sometimes we also have students on the wards. The clinic part of the SAU starts with the day of pre-operative checklist, getting the patients ready for theater and preparing the list for the patients for the day. We have a very high standards of cleanliness, infection, and nursing metrics. We constantly strive for improvement and staff development. At the moment, there are 9 healthcare assistants who are currently undergoing the nurse apprenticeship program. They are training to be nurses as they do their healthcare assistant day job, but on top of that, they are students of the CUH. Since Adam Brooks is known as a teaching hospital, there's a lot of learning opportunities in progress. SAU works closely with the practice development team to make sure that skills and knowledge are up to date. If this sounds interesting for you, please consider a career in nursing in Surgical Assessment Unit.